Hi everyone, my name's Isolde and I studied medicine at Queen's College, Cambridge. Today I'm going to be teaching you how to think like an Oxbridge student. I'm going to be answering an interview question using the REAL framework. So the question I'm going to be answering is, why do you want to study medicine instead of nursing? And I would answer it like this. Having recently read the book, A Gene, An Intimate History, I've realised how important basic scientific knowledge is in medical care and how important this is for developing new treatments into the future. I'm excited by the prospects of genetics in medicine, and as a doctor, I want to be involved in this research. I've also been reading a lot about current trials for coronavirus vaccines, and I'm really keen to be involved in clinical trials in the future as a doctor. I'm excited by the rapid developments in the medical field, and I want to not only be using the new techniques, new drugs, and innovative treatments that are available, but also helping to create them. As a doctor, I should be able to do this by combining research with my clinical practice. I understand that the work nurses do is very, very important and is essential for the health of the population. But during my work experience, I realised that I want to be more involved in the decisions about how patients will be treated rather than just providing the treatment. These decisions lie with the doctors, which is why I think that I would be better suited as a doctor than a nurse. I also understand that the medical field is changing and technology is changing the way we treat people. I'm very, very keen to be involved with this and to see where medicine goes in the future as a doctor and how the role of doctors changes too. I know that AI will change the way that we diagnose and treat patients for the better, and that in the future we will have more wearable monitoring devices, which means that patients won't always need to be in hospital for doctors to monitor them. This should mean that we can monitor more of the population, which, as we have an ageing population as well, will mean that we can keep everyone healthier. I'm very, very excited for my future medical career, and I hope that this has been useful for you. Thank you. So that is how you'd think like an Oxbridge student using the REAL framework. My name's Isolde, and that is how you'd think like an Oxbridge student